Morning, it's 9 o'clock and I'd like to call the Health and Human Services Committee meeting to order. The first item on the agenda this morning is public comment. If you wish to speak, please come to the podium, state your name, and you have 3 minutes to speak to the board. Would anyone like to make a public comment?
They're going to be essential because I did not bring the big thing.
Welcome.
Derek Mullenberg, Holland Township. I apologize. This is probably not, I should be in the next meeting, but I got work to do, so I'll come here. Most of you are here anyway. I wanted to share a little bit about the funding process for people that are watching at home and people that don't look at budgets in their free time, although I recommend it if you're having trouble sleeping at night. It's great. Services provided by the county are funded with local tax dollars through millages. They're also funded via the state and federal government through tax revenues collected by those agencies. Most services provided by the county are funded by a mix of local funds called general fund contributions and state and federal assistance or cost sharing called intergovernmental transfers in the budget. It's important to know that when we look at these budgets, especially total expenditures, that it's possible for a department to have expenditures that far outweigh the local and general fund contributions. Typically, this is from intergovernmental transfers, which also include grant money. One example of this is the Mental Health Fund, number 222. The FY24 budget has $61 million in total expenditures, but only $580,000 in general fund contributions. That's an incredible value to the citizens of Ottawa County, as we're contributing less than 1% of the total funds, while receiving $60 million in benefit. All right, that's great. Let's take a look at the same type of measurement from the health department. The chart that I gave you guys, once again, shows total expenditures on the blue. And sorry. There was a desire for you guys to reduce this to pre-COVID amounts, right? So if we look at the orange line, we can see general fund contributions as a percentage of the total expenditure over time. So we don't have to worry about inflation. This is just looking at what are we funding locally versus the total expenditures. Starting in 2024, we can see values up to 57%, trending downward to 36% in 2015. 2020 is the lowest due to a substantial increase in intergovernmental revenue during that year. The proposed August budget by the health department comes in at 38%, 5 basis points lower than 2023. What this shows to me is that the health department has shown remarkable skill in increasing services to the population without increasing the burden on local taxpayers. By focusing on total expenditures alone as your metric for success, you're penalizing the health department for being successful at grant writing. Is there a reason the health department isn't worthy of grant money while other departments are? Mr. Moss and his business partner accepted $69,000 in PPP loans from the federal government during the pandemic. So I think federal dollars aren't a problem. This should be a slam dunk for the board, right? We should take the money that the government's willing to give us. In March, the board voted unanimously to approve a letter of intent to accept $16 million in grant funding for broadband access. Is broadband access more important than the health of the county residents? I don't think so. In summary, reducing the budget to a single number might be helpful to make charts and convey a narrative, but I don't feel that it necessarily serves the county.
Thank you. Would anyone else like to speak? Welcome.
Good morning. My name's Dave Volta from Grand Haven Township. Wasn't planning on speaking in this meeting either, but I heard you guys were talking about mental health. As a veteran of the Air Force for 6 years who suffers from some mental health issues, I just want to speak on behalf of what it's like on this side of the fence. And that is all about family. If you keep the family together, mental health issues go down. So if the health department will stop handing out condoms to 14-year-olds, 15-year-olds, and stop calling it safe sex when it's anything but, that will help keep families together. I just wanted to throw that out there, that the health department could go in a different direction that's more family focused. Thank you.
Thank you. Anyone else?
Thank you. Harvey Nickel from Jennison. I am here to thank you and to encourage you to keep doing your research. I think I'm going to put this out there. If people in San Francisco, Portland, Seattle, Chicago, Minneapolis, early on would have come up and as citizen government officials fought this agenda that was being pushed over our country, they may not be the hellholes they are today. And I really think that you need to, appreciate finding all the strings attached to these funds. Nothing is free. And when the government says, I'm here to help you, I am very suspicious now, because I saw what they did during COVID, the tyranny that was pushed down the populace, the loss of rights of the people that God has given us. People just let it happen because they didn't realize it. And for the most part, people don't react until it's too late. But I'm glad that you guys stepped in and are doing your research. Our biggest enemy, I think, is the media. I've done all the dividing I can, and I cannot find anywhere there it's an 80%, 87% cut in the health department's salary, which is pushed by the media. Yes, I think we should go back to pre-COVID years where they had about 10.5 million for their total budget. Even with the 13.8, that is about 20% decrease from what they want, but it's actually well above what it was pre-COVID. And I think it's important that they do cut back, because once you give the tyranny, give it away, the freedoms away, you will never get it back. So I appreciate the research. I appreciate the ability to stand up and take the slings and arrows. Being called right-wing extremists, what? Or Miss Evil is too extreme for Ottawa County? What is that all about? A person who loves God, who loves the family, who loves the Constitution, and wants to give the ruling of our county back to the people, which is in the Constitution, and not to some elite globalists. I encourage you and thank you, and I'll be praying for you.
Thank you. Anyone else?
Good morning. My name is PJ Muir. I'm from Grand Haven, Robinson Township. Talking about mental health, just real quick, being a 25-year veteran of the U.S. Army, it's come to my attention that some people think, and there's commissioners here that seem to think that the VA office that we have in Ottawa County is sufficient. For 15 years after I retired, I tried 18 different times to get something accomplished through that office. And all you get is, we can't do it, you can't do it, I don't know, go to the VA, you're not here, we're out of office, out of office, out of office. That office is not sufficient, especially when it comes to mental health. Mental health is one of the most critical things. Just the Ottawa County area alone, and you can check these numbers with the VA, we have about 7 veterans a day that commit suicide. That's just Ottawa County, of the 29 that commit suicide a day throughout the country. So if that's good enough for you, then keep the office the way it is. If it's not good enough for you, then I strongly recommend that you increase that office and you get some sort of PTSD program, combat PTSD program. All right. The biggest problem with PTSD and combat PTSD is they're not the same. Regular PTSD is not clinical. All right. It's clinical based, where combat PTSD has nothing to do with clinical help. All right, you've got to have somebody who's a veteran, a long-term soldier, Marine, airman, or seaman. That's who needs to be in that office, and somebody who understands the VA system, somebody who's been through the VA system, not just somebody who wants to sit in an office, collect a paycheck, and do absolutely nothing for the veterans. Okay, so please, 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 mental health is critical for veterans. PTSD programs and stuff like that, which the VA does not really offer very well. Again, they use clinical psychologists for their PTSD programs, and we lose so many veterans just because you go in there and say, hi, I'm Dr. So-and-so. Veterans don't want to talk to a doctor. They want to talk to somebody who's been there, who's been through it, and understands the whims and the woes of what they're dealing with. So just please consider expanding that office. to what we really need to do to help the veterans, because I will just say this, without the veterans, you all wouldn't be sitting here today and the freedoms that we have. Thank you.
Yeah. Thank you. Anyone else? Okay, let's move on to the approval of the agenda. Is there a motion to approve the agenda?
So moved.
Second. Second. Okay, it's been moved and seconded to approve the agenda. Is there any discussion? Seeing none, all those in favor of approving the agenda, please say aye.
Aye.
All opposed, say nay. And the agenda is approved. Moving on to consent resolutions, we have one item, which is the approval of the proposed minutes from the July 18, 2023 Health and Human Services Committee meeting. Is there a motion to approve the consent resolution?
Motion to approve the consent resolution.
Second.
So it's been moved and seconded to approve the consent resolution. Is there any discussion? All those in favor of approving the consent resolutions, please say aye.
Aye.
All opposed, say no. And the consent item is approved. So we have no action items for this meeting. So that moves us to our committee reports, where we will receive updates from several departments. And we will begin with Lynn Doyle from Community Mental Health.
Morning.
Good morning.
I'm going to give you a couple updates at Community Mental Health. One of our biggest challenges continues to be staffing. At the moment, we have 10 vacancies. That's down from 14 just a couple of weeks ago. So we are doing a little bit better. But nonetheless, that continues to be quite a struggle for us. We continue to have difficulty finding master's level clinicians in nurses and bachelor's level case manager type positions. We have tried a variety of recruiting initiatives. We sent postcards to all licensed professionals that had a social work mental health license in our county and the surrounding counties. We got a few applications from that, but not a whole lot. We are working on recruitment videos, so trying to highlight what we do and why CMH is a good place to work. Those are going to go on our social media platforms, trying to encourage people to at least know about our jobs and consider applying. Some other news for us: in the last month, we've found out that we received a grant, a pretty big grant, and also we were told that we were approved to be part of the state of Michigan's CCBHC demonstration program. CCBHC, again, is Certified Behavioral Health Clinics. The first, I'm going to give you just a little bit of an overview of CCBHC, just because I've talked about it before in here, but we do have a lot of grants and a lot of programs. So CCBHCs are nonprofit or local government agencies that must meet a robust certification criteria. They provide comprehensive and coordinated services. We serve all people regardless of insurance status or ability to pay. And also, we're expected to adhere to pretty stringent quality and cost reporting requirements. The core requirements of a CCBHC are that we offer 24/7, 365 days a year behavioral health crisis services, including mobile crisis. We offer immediate screening and risk assessment, patient-centered treatment planning, outpatient mental health and substance use services, primary care screening and monitoring, targeted case management, psychiatric rehab services, peer support, counseling and family support, and also services to active duty military and veterans. So one of those, the demonstration program in Michigan will bring additional funding and allow us to continue our efforts to increase services, coordinate care, and address health and wellness for our consumers. We also found out that we received a SAMHSA grant. SAMHSA is the Substance Abuse and Mental Health Services Administration. The I&A grant is improvement and, excuse me. Improvement and advancement is the I&A CCBHC grant. That's a 4-year grant. We'll be getting $1 million for those 4 years to help support that program. It is intended to transform community behavioral health systems to provide comprehensive, integrated, coordinated, and person-centered care. And it's used to help improve the existing CCBHC structure. The last thing I wanted to let you know about is the Recovery Fest that will take place on September 21st from 3 to 7 at the Holland Civic Center. This event has been going on since 2004. It's a free event, and it takes place in September to recognize National Recovery Month. The Recovery Fest celebrates the positive impact that recovery from substance use disorders and mental health individuals has on individuals, families, and our communities. Last year, about 500 people attended. This year, the community-wide celebration will provide information and education about recovery and services, and we have 23 organizations participating. There's going to be free food, networking activities, lots of information. And that Recovery Fest is organized not only by CMH, but the Ottawa County Recovery Court, Ottawa County Office of Public Defender, the 59th District Court, Probation, and Community Corrections. And I'll leave you with that unless you have questions.
Mr. Needham.
Morning, Lynn.
Hi.
Would you be able to share the event information with the commissioners, maybe in an email with the
Sure.
date and the time and location and
I'll
some
do
of the
that.
great information you just shared?
Mhm.
Okay, thank you.
Mr. Cosby.
Yes, and question about recruitment. Do you know who are your main competitors? And is there a way that we can be helpful to you as far as benefits or hourly
Mhm.
rate that would help you recruit?
Could you repeat the first part? There was some noise back here and I
Oh,
missed the
yeah,
first thing you
no,
said.
because concerned that you're having some staffing issues, but it looks like we're going in the right direction. Do you know, probably competing like with Mary Free Bed, correct, for the
Mhm.
same roles, MSN or MSW? Do you know just how we compare the
Mhm.
county or the CMH to the competitors? And is there something that we can do to help you?
So we're competing right now for master's level social workers, psychologists, and even bachelor's level with private organizations. It's a really good thing that there is more outpatient help available to people with mental health issues. But what it's doing for us is it's really creating that competition. So these are organizations that are providing outpatient counseling services, either through in-person or telehealth. And they're just able to offer a much more flexible schedule. They're able to offer more money usually. As far as what you guys can do to help, I've had multiple conversations with Human Resources and Mr. Gibbs about thinking about some ways that we could look at our current wage structure, our benefit package. I think there is room for improving not only some wages, especially in certain categories, but the benefits so that we are competitive with minimally our partner CMHs within this region. I think we're doing our best through some of those mechanisms I described about getting the word out there, but I'm certainly willing and interested in talking about what we might be able to do to help fill those very difficult to fill positions.
Somehow get creative with it.
Mhm.
So another question, grant, the CCBHC grant, it sounds like, is there two? Because you were talking about a SAMHSA grant too, but it was CCBHC for improvement and advancement. What's the total value of that? Combined? Is it 1 million for one?
We'll be bringing in a little bit more than 3.5 million for the demonstration.
Is that
the-
annual or
Mhm.
annually?
The way those dollars are brought in through the demonstration project are more, if we provide the service, then we'll get reimbursed. So instead of having a lump sum grant dollar amount given to us, but we're anticipating a little more than $3 million for the demonstration.
So fee for service.
A little
A
bit.
little bit, yeah.
Mhm.
And then I know we just recently, we're doing interviews for a board member position. One of the things that came up quite a bit in those interviews was emergency placement. So as I look at this behavioral health crisis services in 24/7, are we, or do you have a plan for, if somebody needs placement, where would we go in an emergent situation? Because I know it's challenging.
Mhm. Are you talking about psychiatric emergency placement or residential?
Well, it depends upon the circumstance, right? If you're
Mhm.
going out, it's like the crisis service interventions that are there, be it the mobile crisis unit, for
Mhm.
instance. If you have a need for emergency play, you can kind of determine if there's a
Mhm.
need for placement. Do we have a plan in place? Because I know those beds are hard to find.
Sure. So if we're talking about someone who might need psychiatric hospitalization or that level of care, higher level of care, we do have our local hospitals that we will attempt to find placement at. If not, we'll go throughout the entire state and sometimes even into other nearby states to find a bed for someone. If they don't require that highest level of care inpatient, we do have crisis residential options available to us. So that is also something that we can arrange for an individual. We usually can find a crisis bed for adults. They're a little bit more difficult to find for kids. If someone were in a situation where they, for whatever reason, had a crisis situation with a residential placement, our options are much more limited. There are really, in Ottawa County, there is a huge shortage of residential beds. It's not really just us. Throughout the state, people are struggling, but nonetheless, it's our job to help people in crisis and to try to figure out how we can help them, even if it is short term, and then we'll look for a more long-term solution. So that's ongoing work for us.
Yeah,
The 24/7 mobile crisis is something that we hope to do. It really is a staffing issue. We've had a position open for a second shift position, social work position for our crisis intervention team. And it's been open, I believe, now for close to 9 months. And I think we've got one application.
Didn't you once have that filled? And then because of just lack of volume?
The second shift we've never filled.
Okay, because I thought I remember that there was a situation where the just lack of volume, and probably I was thinking communication about the product basically, or the offering.
Children's Mobile,
Yeah.
Children's Mobile Crisis is a team that we do have that up and running again. We're trying something a little bit different this time in that we're having all on-call staff as opposed to having full-time staff on. But when we had the full-time staff on, we truly could not keep them busy. We would get maybe 1 or 2 calls a month. And it wasn't enough work to maintain those staff. So this third iteration, we're really going to be more addressing those calls as they come in on an on-call basis.
Thank you.
Mhm.
Any other questions?
Thank you.
All right, thank you, Lynn.
Thank you, Lynn.
Okay, next up, we have Jennifer Brzezowski with the Community Action Agency. Welcome.
Good morning. Just a couple updates for us as well. We just submitted our annual community action plan for our community services block grant. So that grant is the primary financial resource for the operation of our agency. So we submit that every year. It was open for public comment last week, and it's since been submitted to the state. We were also recently awarded $400,000 to help households with past due water bills. This will be a 4-year grant, so $100,000 per year. And it'll help more households than with the previous water grant that we had. The last water grant required water providers to sign a memorandum of understanding with the state. So a lot of providers opted out of that. So we were really limited in the individuals that we were able to assist. So this grant will open it up widely. And it really had a big impact on mobile home parks because we weren't able to get those MOUs signed. So we're now able to service those individuals, which is great. And this will begin on October 1st and it'll go through September of 2027. And lastly, we have some big updates with our food program, specifically our senior food program. We're just waiting on a fully executed contract with Feeding America of West Michigan. So they're going to be helping us with our senior food program more than they already are. So they'll be storing and packing the food boxes for us. So that we can get really focus on the outreach for that program, and then also staffing the distribution of the food boxes. Just to give you some numbers, we currently serve roughly 350 seniors in the Ottawa County area per month. So again, just having that help with Feeding America will help us focus on outreach and really get out to areas that maybe individuals aren't getting food and they should be getting food or they don't know about the program. Again, we're a staff of 8, so it's very difficult to do that heavy lift without support of other agencies. So we're really thankful for that partnership there. And I also thought it would be helpful just to highlight a story of why a lot of our programs are really important. So we had a 76-year-old woman call us and she was looking for a food pantry close to her. So we got her signed up for our senior food program. So now she gets a food box delivered to her through DoorDash once a month. She's been in the program for about 2 months and she called our program coordinator just to thank her. And she mentioned that now she no longer has to choose between her medications and food. So I just thought that was really powerful to hear how it's impacting individuals in the area. So excited that we could expand that program.
Great.
Any questions?
Any questions?
I like
All
the
right.
use of DoorDash.
Yes.
Yeah.
Yeah, we don't have to worry about seniors coming out if there's bad weather, trying to lift the heavy boxes and put them into their car. DoorDash does all of that for us. So we're very, very thankful.
Great.
Wonderful.
Commissioner Bonham.
Yeah. No, I appreciated visiting your office this week and meeting your whole
Yes.
team. You did a great job of introducing them and all of their special powers that they each are in charge of. It's fascinating, but
Yes, thanks for
I was-
stopping by.
I was also encouraged that you identify people in our community like veterans that could qualify for benefits through our veterans department.
Mhm.
And if they come to you for help for a need, you actually just walk them across to
Yeah,
our
they're
team
right.
there.
Yep, they're.
Yeah. And
within
then
walking
vice
distance.
versa,
Yep.
you
Mhm.
guys work together, which I think is powerful. That's a good thing. So
Yeah.
I wanted to make sure that people knew that you guys actually office together.
Mhm,
And
we do.
yeah.
Yeah, we have a lot of great resources in that building, so it's great.
Mhm. Thank you.
Yeah, thank you.
Mr. Ebo. I think it's great that you provide those food boxes because I know there's a lot of seniors that really appreciate having that.
Absolutely.
So one of the questions that I would always get working at in the hospital when we worked with setting up these programs or
Mhm.
setting up patients was whether or not there was special diets or they were just all just regular diets. So whether they service like the diabetics,
Mhm.
low salt, low sodium
Mhm.
types of patients. So do you know whether or not, what is included in those food boxes, or do you have a?
Yes,
Okay.
so the food comes from the USDA and then it's administered through the Michigan Department of Education through the state. So some of it is like there's a certain number of vegetables, fruits, grains and things like that. So it is a little more difficult with those specialty diets because we pack 350 boxes the exact same way. So there's not a lot of variation. So really the intention of the program is a supplement. So it's commodity supplemental food program. So it's meant to supplement other items. So if there's other dietary needs, we would refer them to other agencies like Community Action House, for example. They have their food club, so they can go and buy fresh fruits and veggies and things like that, or low sodium things. So more of those specialty items are difficult to get because it's kind of a pre-described box of food. Or we also partner with local pantries so that we can send individuals there if they have special dietary needs as well.
Okay.
But it is a request we get, so I do
Oh, I
appreciate you
know
saying
it.
that.
I know it is hard.
It is very
It is hard to
Yes.
feed a community without, because you have those special needs and special
Yes.
diets. So, but thank you
Absolutely.
for everything that you do.
Yes, thank you. Thanks for the question.
One more.
Okay, Mr. Bonner.
Jennifer, when you're looking at our current budget and the cuts that are being proposed to Ottawa Food, how does that impact your services and what you're doing? What do you see as the result of that?
We partner with Ottawa Food quite a bit. They're really a great resource for us. In fact, we did a program with them over the summer and got an additional, I wish I knew the number. I feel like it was 700 or 800 boxes out to areas that were a little more difficult to reach. So they're really integral in helping pull in community partners and fill needs that we might not be reaching. So
Are those family needs, children? Who are you serving through that?
all of the above.
Yeah.
Yep. It's our programs are income based, so it could be individuals, families. It's a combination of the two.
You think that's going to negatively impact that?
I mean, we partner quite a bit with them, so they are a very, very useful resource for us.
Okay.
Mhm.
Thank you.
Yes.
Hey, any other questions? All right, thank you.
Thank you.
And next up, we have Kendra Spanger with the Department of Health and Human Services.
Good morning. All right, just a few updates from our department and some information from last time to answer some questions that were provided. So first, as far as updates, migrant services will be moving from underneath our local department to Lansing or through central office through the Office of Migrant Affairs. We will still have 5 migrant program workers that will be concentrated here in Ottawa and will still be housed in our office, just not be supervised through us. And continue to have a supervisor that will be regional. So she will cover both Ottawa and Allegan counties and I believe a staff in Ingham because they only have one. So there will be a regional approach, which hopefully will be very beneficial, especially across Allegan and Ottawa, as there's lots of services and farmers that might be across both counties. So that will be a minor change for us. I don't believe any programs will be affected, as it might actually create more opportunities with more direct oversight for that program. So that's one change for our office that will be truly effective October 1st. However, that supervisor has already started to cover Allegan as of August. So she will be moving that program out. The other updates is our Medicaid public health emergency redeterminations. As I have said in the past, we have been actively starting those redeterminations that started those in June. We continue to be working on ones from the past and moving forward. One of the questions when I was here last was related to the amount of individuals on Medicaid, both before COVID, during COVID, and post-pandemic. So I want to provide that data to you. So for fiscal year 2019, we averaged 33,079 individuals on Medicaid. That's not only Medicaid, that it also includes our MIHP, Michigan Health or Healthy Michigan Plan. So that includes both of those types of Medicaid. And then for fiscal year 2020, the number was 36,398. And then fiscal year 21 was 42,937. And as of August, we are at 54,150. So it has continued to rise. And if you look at us as far as census data, depending on what census you're looking at, we're averaging between 20 and 25% of our population is on Medicaid. So that definitely is a pretty significant increase from pre-pandemic levels. So you're talking about 20,000 additional members of our community are accessing Medicaid. All right, on our child welfare side, the data that we have rolled up would be for July. We had 265 CPS referrals in July. Of that, 103 of those were investigated. 65 cases were receiving ongoing support services, which means that they had an open CPS case with an assigned caseworker to assist them. On the positive side, we are up to 80 prevention cases, which is great. Some people say, oh, well, why do you want more prevention cases? We want more prevention cases that we don't see those move into CPS cases. So continuing to enhance our prevention, and we are at 2 full-time staff that are working with community partners to continue to keep kids in the community and not involved with CPS. Then we had in July, our number of kids in care was 103 individuals that were in the foster care program. With that being said, we do have 3 individuals that are in residential that are ready for community placement, and we do not have community placement options for them. We also have a young lady that's also located in shelter care, which means that there's not a residential program that she necessarily would benefit from, but would also be beneficial to be back in the community. So we do have 4 youth that unfortunately are not here in Ottawa, that originated in Ottawa, and we would love to have them back. When I was here last time, there was a question actually from the audience about some information about being a foster parent or some more information. So I did bring many swag bags. So anyone, not just the commissioners, can take a bag, please. We are always looking for and recruiting more foster homes. So the question last time was about the number of homes and closures and such. So I want to provide that data as well. So for fiscal year 22, as a full county, not just MDHHS, we had licensed 43 homes. And in the county as a whole, we had closed 67. So there was more closures than those being opened for the whole county. For the department, it was actually more licensed than closed. But again, we have multiple agencies that license homes in our community. And then for this fiscal year, unfortunately, we don't have the data yet for all of the agencies, but I can report for our own office. We have licensed 10 homes for this fiscal year and have closed more. We've closed 18. The rationale for those closures were long-term foster parents that decided to retire and felt like they were not able to continue to commit to being a foster parent. We had a few homes that adopted and maximized their size capacity for how many kids they could have in their home. We had individuals that closed their license due to some of the new licensing rule requirements that started in, I believe, June or July. We had a home that they themselves became pregnant and didn't feel like they could commit to a foster child and their own family. And then 2 that were caring for other family members, older individuals in their households, and didn't feel like they could hold on to both. So those were some of the rationales or reasons in their exit surveys for closure. I also did want to report one more thing. Since we met last, there was a few situations that we dealt with for removals that really needed to have a community partnership and a community discussion. Very happy to report that we do have great collaboration here in Ottawa County. Myself, Lynn Doyle from CMH, and Ann Hurdy from her department, and from the court side, Tom Laddig, we all came together and had some discussions about what we can do to support at-risk youth to keep them in the community, specifically related to things such as disrupted adoptions. And so very excited to report that we had made a request or an application for a lean process improvement, which is an opportunity that the department offers with a neutral facilitator to come in and review processes and create systemic review of what's happening and then action plans. We have done that in Ottawa twice now for our placement team process and for kids aging out of foster care, both of which were very successful. The placement team one has been up and running now for 8 years, very successfully. And so that was submitted to central office and they did approve our process. So we will be working together collaboratively to pull some other entities together that will be working with us, and we'll hopefully be looking at that being set up in January. It does take some time, obviously, with preparing, but I'm very excited about the collaboration that we have in here in Ottawa County. And that's all I have.
Any questions? Mr. Cosby?
And I love the use of lean. That's process flow actually is what you're doing. And so it's terrific to hear that you're having positive results from it too, because you do identify all potential failures ahead of time before you have to fail.
Yeah.
And that collaboration is amazing. So question for you, you made a mention that we're up to 20 to 25% of the population receiving Medicaid. Do you have an idea what's causing that, the increase? You see trends?
Yes and no. I mean, I think a lot of it is education, like people that didn't know that they could apply. I think we're definitely getting more education out there because there's lots of information coming from every avenue. The department is definitely reporting, through social media, advertisements, radio campaigns. So there's lots of advertisement. So I think it's education. Also, we're definitely seeing a lot of struggles with income. People affordability with housing is huge. We see a lot of denials for our supplemental emergency relief because people's housing is not at the ability to be affordable. And so they're trying anything. So maybe they wouldn't have been willing to apply for Medicaid before, but they really need it now because they're supplementing other things they're having to pay. Very similar to Jen's example, about now they're getting food. And so now they can pay for their medications. So I think we're seeing a lot of people reaching out for assistance, and maybe they wouldn't have before because they're having to make choices. And so I definitely think between just education and knowing it's an option and then making those choices would be Kendra's observation.
No, that's why I asked, because we have like a 3 or 4% unemployment rate. So I feel like what you're saying is that there's education, but there's also the inflationary pressures. Food's higher, gas is higher.
Absolutely.
Housing is higher. Thank you for shedding light on that.
Mr. Moss?
Just wondering, do you have a breakdown by age or other demographics of some of those numbers?
Like specifically Medicaid, or what are you looking for?
That'd be one I'd be interested in seeing or learning more about. Yeah.
Yep, we can pull some information for you for next time.
Commissioner Ebel?
Thank you for your presentation. You talked about more foster homes closing than opening. And then you also talked about that some of them closed because of the new regulations and new changes. Can you expound a little bit on that?
Yeah, when I was here last, I had provided some updates on what some of the changes were and where you can find those online. There's some pros and cons, I think, to some of the changes. So there was definitely some changes related to how you are, what's required for ponds, pools, hot tubs. There are some new changes related to locks and latches. There are some changes related to training and requirements for training. Let's see what else. Some of that on the positive, because there's not as many training requirements, but some of it's about the topics that the training now requires. There's some changes with guns and ammunition. There's changes to bedroom size, which they're reporting on a positive because it's not necessarily square footage. We're seeing definitely in some of our poorer communities that people were not able to be approved because of size. And so they changed some of those regulations. There's some changes on male and female able to being in the same room that maybe couldn't before. So it's kind of an if and, like some really like the changes because there's some things that are really beneficial, but some are not willing to, do something different with their pool or take the additional training that maybe they are not interested in. So it's kind of an if and. Some are loving it and some not so much.
Follow-up question?
Yeah.
So with the changes, the new logs, the pool changes, the regulations and all that, are there any monies for these foster? Okay,
Yep.
so there are some monies that
Yes,
they can,
correct.
they can utilize.
Yes.
And you said the positive was that you can have the bedrooms changes. Can you elaborate a little bit on that? Like, can everybody has to have their own bedroom, or can you have 2 in the bedroom, 3 in a bedroom?
Yeah, it depends on this. That depends on the size as far as how many people can be in it. And the gender thing also is based on age, like up to a certain age, they can be in the same room. So it's it has a couple of variables to that. But I can definitely send out the link again that I sent out previously. I can send that out again if you would like.
Okay, thank you.
Yeah.
Mr. Miedema.
Morning.
Good morning.
Thanks for being here.
Yeah.
I guess I'm wondering how many of the ones that closed their being foster parents were due to the extra training, and how much involvement was the training? Was it the involvement of the hours? Was it the training that they had a problem with what the training was? I guess, can you expound on that a little bit?
I believe it was one of each. Because I believe it was 2 individuals that we had. One was they just didn't want, they had already done, we had one type of training called Pride training, and now we have what's called Grow training. So if you participate in Pride, let's say 10, 15 years ago, you now would have to participate in Grow training. So some people were like, you know what, I'm just really not interested in doing the whole new training again. So just the length of time and the commitment that involved with that. Another one of the homes didn't like one of the trainings because there is some requirements to participate in a SOGI training. And so there was one home that said that they were not interested in participating in that as they didn't want that to impact their license. So, so we had one of each.
Thank you.
Mr. Coran.
Thank you. I had to walk out for a second, but what's a SOGI training? I might have missed it.
So that's sexual gender identification training.
Okay. What is that? What does that mean exactly? Like what is that? Just real high level.
Well, I mean, I haven't participated specifically in the training that they take, but it's about talking to as far as the gender of the children that they might be taking, that if the child comes into the home and wants to identify as a different gender than what they are biologically, it's an education training to let them know how and what that might look like.
Okay. And where did that training originate? Is that like state training that's coming down
Yes.
from the state?
Mhm.
Are the feds involved in that in any way, or is it just strictly the state?
I honestly am not sure. I know it's just part of the training curriculum, and I believe the training came out of Eastern Michigan.
Okay. Thank you.
Yeah.
Okay, any other questions? All right, thank you.
Thank you. And please take the bag, everybody.
Okay, next up, we have Adeline Hambley with the Public Health Department.
Hi, good morning.
Good morning.
Sorry, I can't fit my stuff on here. So I shared on Friday some information that I was going to talk about today, but that has since changed since I was essentially talking about the budget for budget changes for public health, and that has updated yesterday afternoon. So I'll try and change some of my information so that it's referencing the newest posting from yesterday. So what I wanted to initially talk about was that the funding for some of the essential local public health services has been restored that was previously reduced, specifically for communicable diseases, immunizations, and sexually transmitted disease programs. And that funding was restored through additional funds from the state of Michigan, as they had put in their fiscal year 24 budget a 25 million increase for essential local public health services. For all local public health, And so the jurisdictions have not yet been told what our award amounts are for that. But it's based on the same calculation that the other essential local public health services is how that's determined. So I believe that that was estimated by fiscal services, and that's how those numbers were put in there. I think that the committee that makes those determinations, helps with those calculations, is meeting next week for the state. So we should hopefully have more concrete number of what we'll get for Ottawa County's allotment. But so those essential services are being restored through that funding, not through additional increase in general fund to support essential programs. I think one thing to note is that those funds were not intended to make up for budget reductions by local jurisdictions, but attempting to correct on a chronic underfunding for public health. So rather than allowing us to have our services go beyond minimum service levels, it's allowing us to maintain that minimum service level. Pardon me. The other thing that's on the newest budget that was posted yesterday is the reduction of an epidemiology position. To provide some more information, epidemiology leads our outbreak investigations. They help to minimize the spread of disease and find the source. Without epi, there could be a delay in identification and containment of outbreaks, leading to increased cases and potential hospitalizations or fatalities. There is a financial cost to businesses and residents, as well as increased liability for delays in illness outbreak identification and containment. Cost estimates for foodborne illness for the 15 most common pathogens in 2018 was over 17 billion in the United States. And I think if anybody's watching the news currently, you're seeing this play out in Calgary, Canada right now. There's a large scale gigatoxin producing E. coli outbreak linked to daycares. There's 329 cases with 33 hospitalized and 32 children hospitalized. There's 6 remaining, I believe. I saw the most recent remaining on dialysis because of kidney failure from the toxin. And this is the same bacteria that we saw with our outbreak for the Wendy's related outbreak in the fall that had 2 Ottawa County children hospitalized for the same thing. Reducing that capacity for us to identify and contain those outbreaks potentially increases the number of children or anyone that's going to be exposed to an illness. They identify the trends and risk factors for over 100 diseases. And that's not just infectious diseases, but also overdoses and suicides. Of note, there's various studies to establish benchmarks as epidemiology is a mandated program and has minimum serviceable levels. The various studies are between 1 and 1.4 full-time epi per 100,000 population respectively. Ottawa County's population is just over 300,000. We currently have 4 full-time epidemiologists. One is funded through COVID grants related to infection prevention. And so that position will be cut October 1st due to the returning of those grants. However, what is being proposed in the current budget iteration that was released yesterday is another reduction to a COVID or non-COVID epi position. That's a core capacity epidemiologist that is for core public health functions. So cutting the department in half and essentially reducing our capacity below serviceable levels for our population, which again, as I've stated before, is inviting the state to intervene to assure minimum serviceable levels. I should also note, as I think Commissioner Cosby was just bringing up when talking to Lynn and the concerns about staffing issues and recruiting highly skilled staff. It's frustrating to hear questions about what you can do to help to staff those positions when we're talking about cutting our highly experienced and educated staff that are difficult to fill. So what happens if this position is let go? Then there is a state compliance order since we're not meeting our minimum service level requirements for mandated service. Like, how are we going to hire, or who are we hiring? A less experienced epidemiologist. This isn't just a field where you can run out and get another with experience. And they require master's degrees. And our current staff is quite experienced. So last, or not last, I also wanted to touch on the health education and nutrition and wellness program is still seeing cuts of almost 50%. The health education and nutrition programs were two different line items prior to fiscal year 23. And so in fiscal year 23, when we did a new chart of accounts with fiscal services, those two were combined into one line item. And if you look at the budget documents, you'll see that nutrition and wellness is 100% reduction from $429,000. And then you'll see the health education line was previously in fiscal year 23 adopted budget was $382,000. But what was requested for this year was just over $800,000. And that is because those two line items were combined. So essentially, by reducing it from the $800,000 requested to $421,000, we are cutting the nutrition services line, right? The health education didn't double. It had two different accounts moved together. And so with the proposal as it is, I think it shows on the budget document as a 10% increase to health education, but you have to look at that nutrition wellness line. And so what we're looking at is a 48% reduction in the funding for that. And now health education is the program that runs our Ottawa food program. So all of the programs are at risk for reduction or elimination based on that, on the budget allocation as it currently is. The program cannot sustain a 50% reduction and not see really significant impact in FTEs. Almost all the costs in that line item are salary and fringe for core public health that existed pre-COVID. So again, I know that the narrative is pre-COVID funding, but if we're cutting 50% of staff that existed running programs that existed pre-COVID, then we're not funding pre-COVID. So some of the programs in health education and nutrition now combined, we have Senior Project Fresh. It's a program aimed at helping older adults eat healthier as they age. It's income eligible residents 60 and older, free nutrition. And then they also get financial coupons that can be exchanged for fresh fruits, vegetables, and other healthy foods sold at local farmers markets. Right now, there's over 350 low-income seniors that are helped by that program annually. Ottawa Food, the line item that is frequently referred to as being fully funded is an operational line. It is not the line for the staff that actually run the program. So while the operational line may be funded, which I believe is around $8,000, the people that actually run the program are not funded in the current proposal. Ottawa Food has many important different services that they do to provide community access to healthy, local, affordable food. There's a gleaning program at local farmers markets. I think this is really impressive, but they gleaned over 22,000 pounds of food so far this year for people that are in need of food. Produce donation program at local farmers markets received over 2,100 pounds of fresh produce so far this year. And they also have a pick for pantries program where residents can donate any portion of what they pick at local farms. And then all food received through these programs is distributed through local agencies, households facing food insecurity. And as we heard from our previous speakers, Jen and Kendra, they're seeing increases in use. I think that the Medicaid number that going up 20,000 since 2019, obviously she can't be given the directive to bring that down to pre-COVID levels and just cut 20,000 people off. Those are the same people that we serve with these various programs. These are for our marginalized and vulnerable community members. There is also a state mandated requirement for nutrition and health education. There is the Ottawa Food expansion of Lakeshore Food Rescue. That is in conjunction with Community Action House, not to be confused with Community Action Agency. So this was an initiative to expand. I believe our CRR, one of our staff, was in front of this board in January for this grant for a refrigerated truck that they utilize for this program. They expand food rescue across Ottawa County, and they've rescued more than 1 million pounds of food and redirected it to households experience hunger in Ottawa County. So approximately there are 22,000 food insecure residents in Ottawa County that are served by the programs in Ottawa Food. There's also Suicide Prevention Coalition. They have different programs, including Blue Envelope, which is a team response training to school staff throughout Ottawa County. Over 2,000 staff are trained, and they have responded to nearly 600 youth incidents in 2023. They also work on the Be Nice program with over 12,000 students actively involved, and question, persuade, refer trainings throughout the community. There's over 1,200 in 2022. 8,000 safe home lock it up bags were distributed in the community in 2023. Health education also provides Serve Safe classes to our local restaurants, managers, and staff. They're required licensed food services to have a certified manager on staff. And so this is an important program and helps local businesses. They do substance use disorder prevention services. One that is unique is TIPS training. It's alcohol server retail training. It's required under the Michigan Liquor Control, but we provide the training for Ottawa businesses. Has helped over 100 small businesses save nearly $50,000 in training costs. It helps bartenders and restaurant owners notice problems of intoxication, drunk driving, underage drinking, and when to cut off serving. Prime for Life classes are twice a month for students in juvenile court and schools. Over the past 2 years, 180 students have participated. They also do vendor education yearly to over 300 retailers to reduce youth access to alcohol and nicotine. And again, and I don't know if it was very clear, this has been communicated to others, but I don't know if it made it to the board, that health education and nutrition were combined. So if you look at your sheet, you'll see that cut in nutrition line services. But I wanted to be very clear that while the operational for Ottawa Food is funded, the staff that actually do the work are not. Last, what I wanted to touch on was the family planning Title 10 funding, and that is also what had changed as of yesterday with the board, or with the new packet that was posted yesterday afternoon. The Title 10 funding that we got for our Ottawa County Women's Health Services, which is family planning. We have minimum service requirements that we have to meet in order to receive that federal funding. Going into this year, as this budget process starts really in January, and when we're given estimates to work within from fiscal services. And so the estimate we were given to work within was to keep it flat, our budget from last year. So going into this year, we had our family planning program was already looking at not refilling a clinic manager position and not refilling 1.1 FTE, or a full-time equivalent is what that stands for. Clinical staff, I believe it was a PA and a nurse, part of a nurse. And so that means our family planning services were already, when the budget we proposed, were coming in at the very minimum that we needed to operate. With the original budget that was proposed, original budget reduction, it would have put us below the level that we needed to maintain the federal and state requirements for Title 10. Now, when that happened, especially when the first budget request of $2.5 million was brought up, and I brought up concerns with that, and I was told to create a budget of $2.5 million. That was when we realized that we would close. The health department would not be able to operate, as we would not receive any funding from any other outside agency. And when that happened, we contacted the state of Michigan as we needed to have somebody to refer our patients to for all of our services. And so this is where we contacted, obviously people that use us for their services are not able to go without that. Title X funding is federal funding that passes through the state. It has to go to a Title X provider that has capacity for their services. The nearest Title X provider that has capacity for additional patients is Planned Parenthood in Kent County. This should not be a surprise to Administrator Gibbs, as I have mentioned this numerous times, as to how that funding worked. And I believe in our very first meeting in January, when we met with Administrator Gibbs and Deputy Administrator Patrick Waterman, and numerous other times when we have met, I asked, and I'll tell the same story here. The Women's Health Program, Family Planning Program was approved in the 70s by an Ottawa County board. Certainly the board that was elected in the 70s was not a leftist progressive board of officials. They purposely chose to tie up this funding because they wanted to maintain control of Title X funds. For 52 years, we've had those services and have relayed very similar, this exact same, almost word for word, the history of those funds and what potential cuts if we cannot maintain the service level that we have to maintain specific to those grants to Administrator Gibbs. So to hear it referred to in the public hearing that there's a rumor circulating and how our programs don't meet its funding, that Planned Parenthood will be funded is interesting, as though it's not a rumor. I had explained and communicated that to him numerous times in an attempt to prevent that from happening. I'm glad to see that something changed between Friday and yesterday and that those funds were restored. Thus, we can meet the requirements and we're minimally staffed to do that and maintain those Title X funds in Ottawa County. Last, what I wanted to address, as I think it's important to communicate the misinformation, I would say, that's put out there that I heard that came up in the public hearing. And I believe I shared that document with the chair, Rhodey, and to address some of those issues that were brought up. Oops, excuse me. I believe that, as I said before, the narrative that's frequently coming up are returning the budget to pre-COVID levels. That is certainly the narrative now. 2.5 million that was originally brought up, and when my concerns were raised that we would not receive any funding at 2.5 million. And so once we take out our indirect costs, that we would operate for weeks, were not heard. And so 2.5 million was requested again. It was at that point in time, as I have a duty responsibility under the public health code, if there's a threat to public health, which closing the local health department certainly is, to communicate that. I did not communicate that with the public until my concerns were ignored when I raised them privately first. When that was doubled down and then insisted upon a 2.5 million, that was shared with the public. Now 2.5 million is no longer on the table, but we're going to return to pre-COVID budget levels. As I explained, talking about the EPI position and health education and nutrition, when we are cutting positions that work on core public health position or core public health functions that existed pre-COVID, then we are obviously not returning to pre-COVID budget levels. They believe there was stated there were no cuts to children's programs, that Miles of Smiles was fully funded, and that Ottawa Food was fully funded. That wasn't true at the time. I believe it showed right on there that Miles of Smiles was not fully funded. It's my understanding that part of the reason for the cut for the EPI position in the mandated program is to fund the Miles of Smiles program. And then the Ottawa Food, again, the operational was funded. The people that do the work, that is almost 50% cut. The Minimum service levels were provided. Mr. Gibbs is right. There is not a chart that has for each county to tell you how many people you need to do each thing. They're performance-based metrics. I provided those. Happy to talk about them. They are complex, but it is based on the work that you have to do and the timelines you have to do it. Of course, that varies. I would say honestly that for example, our well and septic program is likely lower staffed for how much work we have than other counties that may have less applications come in. And part of that is because all of our records, the county paid, I don't know, 8 years ago or so to scan everything in. It's all digital, everything's electronic. They have computer systems to do the work where a lot of other counties are still hand drawing. So those things affect how many people you need to do to complete the work. But there are performance metrics that we have to meet to do that. I believe that there was some requests from Commissioner Cosby about the information in its entirety. Again, numerous invitations have been extended and not accepted, or no one has come to the office or to learn more about what we do. I did, however, share programming, previous accreditation reports, one-page documents on our programs, previous annual reports, communicable disease reports, FTE documents that were also provided on June 19 with Administrator Gibbs and Commissioner Rhodey for our financial meeting. At the time, when I first received your request, we were right in the middle of these requests for new budgets. And at that point, with a new iteration happening essentially every 2 days, it seemed there is not time to create a specialized report at that point. One thing that stood out to me too when I was listening to the public comment was the phrasing that a business leader to use for reporting on business with the Board of Commissioners. And I think it's really important to note that public health and most government services are not a business. That's not to say that we shouldn't be efficient and cost effective. However, we are providing services to the community. And for public health, those are services that are established by the state constitution, further solidified in statute, and are in fact a right inherent to the people of Michigan. We're not a business designed to make profit. And then last, I wanted to touch on the chain of command and creating unnecessary fear in the county. As the appointed health officer, it's a matter of law that I'm an administrative officer of the health department. I can take actions and determinations necessary and appropriate to carry out local health department's function, delegated under the law to protect public health and prevent disease. So there's not a chain of command breached when I am communicating information to the public that is important to the public health. And certainly when we were looking at significant budget cuts to the health department, we would no longer be operating. That's a significant public health concern. And certainly my communicating the consequences of the potential actions of the board are not my causing the fear mongering or creating fear in the community. And I say, like I would tell my kids that actions have consequences and you have to own those consequences. You don't get to put those on someone else. Your choice is to cut the budget. And what I would say, a last minute ambush way outside of the normal scope of budgetary process they have consequences. And I'm going to communicate those to the public when they are going to directly impact the services that we provide. But however, the fear or concerns that those may raise in the public are not my consequences to own. So that's what I have.
Thank you. Do you have any questions? Commissioner Moss?
Yeah, thanks for coming today. You had mentioned the committee that's meeting next week. I think it was related to ELPHS, and they're looking at state level funding.
Yes.
Do they, it's just kind of a general question. Do they know that having that information earlier would probably help a lot of county governments? And
yeah,
is there any opportunity they can meet earlier or receive feedback to meet earlier so that those numbers?
I think that receiving feedback, I know that we've shared it. There's a health officer forum And there's like an environmental health managers forum, have all shared very, very similar feedback. So it might be something that would be really useful to come through. I can't remember what is it MCC? I don't remember what the commissioners, it might be really helpful for something to come from there. I think one of the other things along that's very similar is and this is maybe for Jack, the last minute issuance of some of our contracts. So a lot will come through egrams. However, there are specific contracts for services like for Eagle, which are mainly septic. Those contracts are almost always issued in November. I mean, they're like after the start of the year. So, but I'm happy to share more information if it's something you would like to provide feedback on, because it is an ongoing issue.
Do you think in general it might be possible for them to move those up? Like if it's feasible in general, or are they constricted by maybe other budgetary processes?
I am not sure on that, honestly. I know they've gotten feedback to move it up and they haven't, but I don't know what the constraints are to do that.
Okay. I'm glad we have estimates. That's good.
Mr. Cosby.
So question for you. This role is new to you. And so in the past, can you explain to us what your budgetary responsibilities were?
Yeah,
Annual
so
budget.
I'm sorry, what?
The annual budget?
Yeah, so every year I would create budgets for all of the programs regarding staffing, operational, you're assessing. Usually I would take quarterly estimates for how many applications or services that we would provide and try and estimate what that might look like for the next year, because we're creating budgets. Usually the conversations start in January, setting, because fiscal services will set the amount they want you to work within. And so those start in January. We have to then input them into the system in May. And then we have meetings with department heads and fiscal services. Those usually happen in June-ish, right around then. When doing budgets, there's I think public health has some unique economic identifiers that you can use to try and predict, because part of the difficulty is doing it so early in the year. You're trying to predict on numbers that aren't necessarily, you're only into February, March, and you're doing your budget for the October, the whole next year. But there are programs. The real estate program is a great indicator for economics, since it's like home sales. And so we can use kind of how we're seeing that growth or not, how that's going to try and predict if we want to stay level or decrease or go up. Another program that remarkably, I think you wouldn't think of, that's really helpful for determining that, is the sustainability program, because they get money from landfills based on the amount of waste that's dumped there. And it almost always has about a 2-year lead for economic. We saw decreases in that program in like 2006 or 7, and then the economic recession really hit in 2008 and 9. So we use those things to try and determine. But I was responsible for the budget for the 3 different programs. It's about around 6. Those things was over 6 million.
So now it's the full breadth of the health department. This was your first year.
For all of the departments, yes. Yeah.
And then we are in the budget proposal phase.
Right. However, these proposed anytime. I was very much involved when we had in 2009, when we had budgetary recession. And if there was truly a discussion around fiscal conservatism and wanting to reduce the costs, that happening in August, mid-August, late August, as part of a conversation. And I would say most of the time when I'm sharing information with the public or with commissioners that have requested information on the budget, my information is what they're seeing. So to say that what has been occurring has been a budget conversation, I would say would be inaccurate.
Okay, so when I asked for the business metrics that I did, the programs that came in one email and program purpose. The resources, I finally got the human resources, which evidently had been shared in June 19th. Supplies, but the visit volumes. And it doesn't matter if you're a profitable, business, but it still has a business model structure to it. And what I was looking for when I was asking you for that information was my ability to help you. And I was looking for whether or not, it's like the work that we're doing is where it's most valued in the community. And what was the cost for delivering that work so that we could direct resources to those valued programs. That was the only thing I was asking for. And I asked for it for 9 months, which is on record.
I don't think that's accurate.
It is accurate.
You emailed me on August 26th.
No, I asked for, and you had my December communication with Mr. Shea. I think it was December 16th.
Right, because I was on
that
that
was my
thread.
personal
Yes.
communication
Yep.
with Mr. Shea.
Mhm.
So I had asked him in November as well for that very information is how I understand a business unit. And I think it's normal in business practice, just to understand what is, it's like, what are those value added programs? What's the work you're doing? How can I be helpful to you? Those were the only reasons why I was asking. And I could have been even more helpful to you had you provided those to me.
Well, I would
not
extend the
one-offs.
invitation again to please come to the department and learn more about what we do, as that invitation was extended in December and through all the other 12 pages of emails that I sent you. Please come learn more about what we
I've
do.
been at the health department for a brown bag. I have been there.
Okay, well, if you would like to learn more about our programs, invite you to come.
The good news is we're going to have budget software that I think will provide you this information. So every business leader does know the essential functions.
Except
the
you should
metrics.
realize that there are some things that are required in statute and law. And those have to be provided. And it's not a matter of if there's one person that we do, if there's one person with TB, we have to provide that care and that follow it, that case management and that treatment for that one TB person. So we don't get to say, but that one TB person was antibiotic resistant and we had to pay for them to be isolated and quarantined. And that cost us 15,000. So we don't do it anymore because it only was one person for 15,000. Like, so there are considerations that have to be made that are not just, cost benefit.
And the good news is I understand that and I can be helpful.
It's
Thank
good.
you.
I really do. I'm being completely honest. I would love for you to come to the health department and learn more about what we do.
So
Phones aside, right?
I'm sorry, what?
Phones aside, where we can just talk to one another.
Yeah,
That would be great.
that would be lovely. Truly.
Thank you.
Mhm.
Mr. Bottomo.
Thank you. Addie, thank you for coming and bringing so much information to us today. Wanted to focus us back on the items that you're bringing to our attention in this meeting, and just make sure that I'm hearing you correctly, and really just want to lower the temperature in the room a little bit, kind of set personal issues or politics aside and really talk about the needs of the community, because our tax dollars have been paid to provide services back to us as citizens to serve us and protect us. So before I get into EPI and the nutrition program, I wanted to say I'm grateful to hear that the Title X funds, which I hear are in excess of $200,000, are going to remain here in Ottawa County under our control versus going to Planned Parenthood to use to open up a door in Ottawa County. So I thank you for your work on that. That's good. Is about 206,000?
Yeah, it's right around there.
It's right in there.
Yep.
So it's a meaningful amount of money. So I think it's important that we continue to control that.
I agree. I think it's important to have those services. Usually the folks that need those services also have problems with the distance to get to them. So it's important to have them here and embedded in the community. So I'm grateful that the money was restored so that we can maintain those services.
Great. So I wanted to focus back on the epidemiologist that the situation that you're bringing to our attention. We had 4, and the desire is to scale back some of these services in the health department to pre-COVID levels. And in effect, what's being requested is to scale it back to 2. One being cut out of the fund and then one being cut via a grant.
Right.
So the standard that we're supposed to maintain is 1 per 100,000 population, and everybody knows Ottawa County has about 300,000 people. So we should be meeting the standard of at least 3, right? And with that, we could choose to bring back one of those either through our county dollars or through a grant.
Correct.
And the grant would have the least amount of impact on the taxpayers of Ottawa County. So to me, I think we could consider looking at that grant again. I know that you were instructed to cut all grants that were in any way, shape, or form connected to COVID. And this is one of those grants that is taking away these funds. But what this grant funds is disease prevention, right? Infection prevention. And it's not just COVID related. It's salmonella, it's meningitis, it's hepatitis, it's all of these diseases that are in our community. And so maybe we can, I think, finance and administration is coming up. I think this is a topic that's worth discussing again, is looking back at this one grant that's funding this third epi that we need to maintain here in Ottawa County to bring that person back. So do you suggest that we do it that way, or?
I would certainly be any way that we can maintain the third person for a core function. It would be great. Now, if that is maintaining the funding as originally requested for that position, or if it's through the infection prevention funds so that it's not additional general fund, then absolutely.
I mean, I agree that we could do some scaling back. We've talked about this, I know that means scaling back on services and some staff even, and that's appropriate. Times change. And so we look at things like that. But here's something where I feel like we've maybe scaled back too far, and maybe we can course correct a little bit at no additional cost to the taxpayer because we have this grant available to us. So I think that's a reasonable thing for us to discuss during finance administration. So I wanted to put that, basically on your radar to talk about later this morning.
Madam Chair, if I may address that point. As far as I know, there were not 2 epidemiologist positions cut. There's only one, the one that was funded with COVID funds. I'm not aware of 2 of those positions being cut.
Thank you.
That would be great news, and I would love to have that confirmed because that was not my understanding. But I know for sure the one that is tied to the grant is cut with the grant funds. But my understanding was that a FTE that is not related to the grant funds was being cut. So if not, then that would be amazing.
Yeah. So are we confirmed that we're maintaining 3 epidemiologists in Ottawa County?
That is my understanding. I'll confirm that with Karen.
Okay.
That'd be great.
Then if we don't need to address that during FNA, that's great. So the next one is, you did a very good job of explaining the nutrition wellness line item in the budget was completely reduced to 0 and mingled with the health education budget, which was then slashed by half.
Yeah, because I think when you're looking at the forms as they are in the packet, it would look like for whatever reason, health education, that line doubled, right? Because the budget as adopted in 23 was 381,000. So all of a sudden seeing it at 800,000 is what's happening there, right? And so it was reduced to 421. So it looks like it's slightly more than it was in 23. However, again, if you go down to the ends part of that, under public health, you'll see the nutrition wellness one was zeroed out. And again, that was part of the whole chart of accounts. I think Karen has talked about it when she's been here. They're reworking how the account numbers are done and our chart of accounts. They match up with, there's probably a financial or fiscal accountant word for it, but it matches up with the chart of accounts for like the state and so that it's easier to reconcile. So those 2 programs were combined into one. But it's not necessarily clear on this document.
So maybe I could ask for clarity from our administration. Is Ottawa Foods budget going away?
No, and nutrition and wellness is not going away either. That is not the case. There was a reduction, but that in no way, shape, or form reduced nutrition and wellness or Ottawa food. That is not the case.
So can we talk, we have Addie here. Do you understand what he's saying? And
I don't,
Okay.
Because the total budget requested for health education, nutrition and wellness was 800,000 and we have 400,000 funding. So that's
So
48% is cut.
and we have latitude in deciding where that funding is going to be spent. So it is definitely not the case that it is definitely going to come at the expense of 100% cuts in nutrition and wellness. That decision has not been made. I'm thinking of more giving out condom cupcakes at GVSU, or teaching bartenders how to say no to a drunk drunk customer, which was literally explained just now. I'm not sure the taxpayers of Ottawa County will be happy with their money being spent on such things. And I'm sure Commissioner Bonema, you might agree with that. So it is not the case that just because there was a cut, that means nutrition and wellness is going away. We can decide what gets cut and what doesn't, but that decision has not been made yet.
so I'm just looking at the numbers. I'm a numbers guy, math, right? So we've got half as much money to work with to fund these two projects that are going on, health education and nutrition. We have families with children, elderly that are relying upon these services that our tax dollars have been paid for. So I want to make sure that the citizens receive those benefits. So if we have half as much as we did before, why is that necessary? I understand the comment about the cupcakes. Yeah, okay, but that's not
Condom
really what we're
cupcakes.
talking. Condom cupcakes. Yeah, I understand that comment, but that's a minuscule amount of what we're talking about when we're talking about feeding families and children and elderly and the people that rely upon this program. So I'm advocating for answers for them, not necessarily the cupcakes, right? That's something that can be handled separately. But here I want to make sure that the health department understands what they will be able to work with and Ottawa Food, because she mentioned too that the staff is not funded. And so do you understand that in the line item, it says that the staff that works with Ottawa Food is not funded?
That has not been decided. And I do agree with you that we do want to look at the numbers and decide where that gets spent. You said it's about the numbers. It's also about the programs. We want to decide which programs are our priority. So that is a process we'll be going through, and it has not been decided that Ottawa Food or nutrition and wellness is going to be cut. That has not been decided yet. That is a process we will go through.
So, okay.
Commissioner Bonema, your time is up, and I think a lot of this discussion really is better served in the finance
Is
committee.
there a time on me to ask questions?
Yes, we have 10, you have the floor for 10 minutes and you're at 10 minutes. Commissioner Curran.
This might be a finance question, but do you want me to ask it now? Or, so it seems to me that as we've gone through the budget process, there are things that have been cut that have then been brought back and tweaking as we work through. So it sounds like you have a line item. I'm assuming there might be a possibility that that number might change, as well as where that funding goes. Do you know when you will have the decision made, or when we can expect to see what's going to happen with this particular line item with the health, education, and nutrition wellness?
As far as I understand, these are the numbers.
Okay, so what you said was there's a possibility, like you decide where the funding goes. When will we have the final decision on where that funding is going to go?
That's a programmatic decision. And so that doesn't have to happen by October 1st. That will be decided in consultation with the program.
Okay,
And this is a cut to half FTE. And I can say, for an organization, that the level of professionalism and how this is treating people, there's a reason I think our staff is unionized for the first time in 20 years to tell people 4 days before October 1st. Again, when they work in core public health programs. This is not staffing for COVID. This is not increases for COVID. And to notify people 4 days before the first of the year, if these plans were actually planned as to be fiscally conservative and not actually a retaliatory political move or whatever for anger at the health department, these conversations could have happened months ago, because that's how you treat people that work in an organization. You don't do 4 days to tell them that they're out of a job. And I would also say that with the unionization, the ability and the actuality that any of this will be able to be implemented on October 1st are virtually zero. So.
Commissioner Cosby.
Yeah, I'm trying to look for that FTE worksheet that you gave us, because if I remember correctly, and this is extemporaneous, right, as I'm trying to find it. Originally, you had like 97 FTEs pre-COVID. And year to date, I think budgeted, you had 122.8, if I remember. It was like 0.86 kind of triggered me there to take a deeper dive into it. How many of those are unfilled currently? Do you know? I can kind of start to dig
So
here
of
if I
all
need
of the, I can speak to the COVID, excuse me, COVID specifically. So a bulk of those are COVID temporary related to the grants. So they go
I
away.
think it was like 10.
No, there's like 30. There's full-time and part-time for COVID funded positions. And those positions go away with the removal of COVID grants. Of those, of the 30 some FTE, there are currently I can't remember if it's 3.4 or 3.6 are filled with people. One is an epi. And then there are a couple other positions that help do surveillance and questions and whatnot. Support activities. So those go away. So we have right around 100 FTE for our core FTE or positions for core public health functions. Of those, as far as what are we have and what are filled, I can get that for you, but I don't have that off the top of my head.
I did have it here, so I apologize for it, but I mean, it's significant. I mean, it's like 25 FTE increase in less than 3 years.
Related to COVID. Those are COVID positions. And if you do not believe me,
I believe.
I'm sure Marcy is happy to confirm
I'm
that.
looking. I
So,
was not disagreeing.
okay,
with you at
those
all.
are, so they
No,
go,
I'm just
and
trying
that
to
increase
remember.
is absolutely related to COVID and grants and go away with COVID funding.
Nope, it wasn't a dispute at all. I was just
So,
trying to
yeah.
find that. As we're talking about cutting FTEs, I just want to point out that we've had a significant increase in a 3-year period of time.
Related to COVID, yep, and
25%
COVID
of your
response.
department approximately.
Yep, that are currently not filled. So I'm not sure what there were a significant number of positions added for COVID response. They are not currently filled and they
Again, just
currently
again,
go away October 1st.
Yeah, the relevance of a half of FTE cut, and that's going to be to your discretion, I think, programmatic and by program. To what you've.
It's a 50% FTE or 50% cut to the budget. So that's more than half an FTE for health education, if that's what you're talking about.
Half an FTE is what I heard you say.
A 50% cut to the funding, 48% to be accurate, 48% cut in funding to health education. That's far more than a 0.5 FTE reduction. So.
Commissioner Zylstra.
Yeah, I just want to pick up a point from Commissioner Bonema. I mean, the A1 budget from health was 814 for health education. You know, we have been pointing out that, and the health officer has been pointing out that there's almost a 50% reduction. And I understand that there is programmatic discretion, but there's no way you can sustain a 50% reduction in that and just, you know, spend that on cupcakes for condoms or condoms for cupcakes. I mean, there will be severe cuts to significant programs in this county.
Okay, any other questions for Addie? Thank you. All right. So this is now our second opportunity for public comment. If you wish to speak.
I'm sorry, she had.
Oh, I'm sorry.
That's okay. No, is Kendra still in the room? I just had a quick question for her in reference to that. I think it's a SOJ training that I thought of, if that's okay.
Okay,
If
that's-
not, that's okay.
That's fine if she's still in the room. I think she's
She might have
gone,
already
so maybe you can
Okay.
email her.
Yep,
Okay.
Thank you.
Yep.
She's in the back.
She's in the room.
Yeah.
Oh, no.
Sorry, Kendra, do you want to come up for a second?
Hey there, thank you.
Yeah.
As I've been pondering as we've sat through the meeting, in reference to this, is it SOGI training? Is that what it's
Yes.
referred to? Okay.
Mhm.
I know that. Are they encouraging parents through this training to, or are they encouraging foster parents in this training to take the children for puberty blockers or for anything, any modifications to their body or anything like that?
No, it's an education training to let them know what kind of questions we may be required to ask in order to provide a good fit for matching our foster parents with the kids. So if a kid comes into care and they are biologically female, but they identify as male, we need to provide that information to the foster parents to let them know that that's how the person identifies. And so that's up to the foster parent if they choose to have a license that says, yes, I will take individuals that identify with a different gender than what they are biologically or not. So it's an education piece to say, here's what you could see in the community, and here's how you would address it if you were interested in taking those youth.
Okay. Is that something that the program does though? If a foster parent takes a child who identifies as a different gender, where they would encourage the foster parent to then take them in for puberty blockers or anything like that? Like, is that something that the foster facility for the state is trying to facilitate?
Any child that comes into care is their parents' parental rights are still intact unless they've been terminated. So that would be completely up to the biological parents.
Gotcha.
Any of that would be up to the biological parents. That would not be anything the foster parents should be involved with.
Okay.
Unless the court orders it directly, which would be a local court decision, or the child is a state ward, then that would be through the Michigan Children's Institute. But there would not be anything specific that the foster parents would have the right to be involved with any of that. That would be up to the biological parents or the MCI for the child.
Okay. Thank you.
Yeah.
Appreciate it.
You're welcome.
Thank you, Kendra. Okay, now moving on to public comment. This is our second opportunity for public comment. If you wish to speak, please come to the podium, state your name, and you have 3 minutes to speak to the board. Would anyone like to speak? Welcome.
Hi, I'm Cindy Cornelia. I'll do my best to say this, okay? Years ago, I was in business and we did budgeting. What a pain in the, you know what? And trying to understand all of this. And I do have to commend all of you for trying, for working on these different departments and try to understand all of it. I mean, I was in banking, banking's banking, okay? Although you'd be surprised how it changes, okay? So I appreciate all the changes, and Mr. Bonema, you're trying to find some other solutions, that's really great. But why did this become, it just feels like it became a circus that, instead of going through this and working on it on the back side and then presenting it, it has gone out to the public and become a crazy, crazy circus. I don't understand why that had to be. I know there's an issue with the position and all that kind of stuff. I get it. Okay. But I also have to realize that all of you need to understand it, and it needs to be given time, and the person trying to educate needs to give that time and work on that also. So my hope is that you guys can kind of work together a little bit better on it. So anyway, thank you.
Thank you. Would anyone else like to speak?
Karen Novitz, Spring Lake. So what I just heard now, what I've been trying to wrap my own head around, is this process that I think the previous commenter was speaking to. From what I understood of what Director Adeline Hambley was trying to explain was that, yes, this was a very different process this year. I'm not going to try to get into the reasons why that may have been, but I do think we are seeing the results of that. And I'm always open for being educated. But one of the things I try to listen for when I hear the back and forth that we heard this morning was not just the programs and the monies and the issues about those monies or those positions, but the people. Who are the people being served? Who are the people the state mandates our public health department has to serve? We may not like the fact that those needs are there. We may hope that we can rectify those needs so that these services aren't needed in the future, but the point is they exist. And we have to meet those people's needs. And as a taxpayer, I want my tax dollars portion of the county's fiscal oversight of our budget for the entire administration to be used primarily for serving people. And if the process that we saw unfold this year, particularly as it pertains to the public health department, is any indication, I think a lot of people were getting thrown under the bus. And I don't like that at all. And I want to encourage this board to think about the process, to think about the ways in which the people who do the work and the people who have been doing this work for some time are the people that should be at least the first person to answer those questions in a way that isn't going to turn it into a public circus. And watching the people that are represented by all of that get literally thrown into the bus has been very distressing to me. So I want to urge for a better process in the coming year. Thank you.
Thank you. Anyone else?
Good morning, Lori Grassman, Robinson Township. I would like to speak to Commissioner Cosby's request for certain things from Adeline Hamley as far as numbers and things like that. And I actually FOIA'd for those specific things because I was also curious myself of the people and the numbers. And after hearing you speak, I was curious as to how many are we helping and how many are employed and stuff like that. And I would just like to say that I think you're right, because I got a response of a certificate of non-existence. So evidently they don't maybe have those numbers or can't be produced because they don't keep track of them or they're not on paper or something like that. So I do thank you for digging. I don't think an obvious visit even can produce those, because if they can't produce them on paper to one of the citizen taxpayers, maybe they're not there. Thank you.
Thank you. Any other comments?
Hello, board and community. I'm Bonnie Tardif. I see many Christian men here, and that's great. I was raised in a Christian Reformed church and had perfect attendance in church and Sunday school my whole childhood. During that time, my sisters and my aunt were repeatedly, numerous times raped by my father from the age of 6 until 11 by my Christian father. He only stopped because he told us we were at the age of getting pregnant. Whenever I attempted to tell my mother, she accused us of being troublemakers. And I don't know why you girls always get like that when you get this age. My aunt was branded a troublemaker and made the black sheep of the family. She eventually committed suicide. I am an RN. I worked at Holland Hospital for 19 years, many of those years with Lucy. I thought she was nice, but I can't understand how she is being so heartless in her and the board's approach to the marginalized. Adeline Hamley is a hero for the marginalized. She has provided support for and resources for those who weren't lucky to have a father who stopped having intercourse with their children is to stop at the age of 12 so they wouldn't become pregnant. To take away any monies from support for her department is cruel. In fact, you should be throwing money her way to continue the very Christian-like principles she is upholding. The $243,000 allocated for supplies should go to her. The veterans clearly don't want it. During COVID, the health department website was invaluable in informing our county of what was going on. I believe the smearing of Adeline's good name is typical bullying tactics. They say if one steps up to say, stop it, it goes a long way towards getting rid of bullies. That is what I am here to do. Fully fund the Ottawa County Health Department as it presently is. Stop the madness. Be the Christians you profess to be. Do not punish your constituents because of your petty revenge. They kept us safe during COVID, not people like you. 66.8% of the people in our prisons are women. 93.2% of the people in our jails are men. There should be more there by the grace of God and women. Thank you.
Thank you. Any other comments?
Hello again, my name's Dave Volta, and just a few thoughts here, kind of randomized, sorry. But Mr. Bonham asked about budget cuts and if that would affect the program, and I have to say, of course it does. When I have a budget that's influenced by inflation or loss of work, stuff like that, it affects it. So does my tax dollars being used for philanthropic activities, such as providing condoms and birth controls for young women without parental consent. So I would like to encourage you that budget cuts themselves are not bad. Sometimes they can be fiscally responsible. Ms. Hambley said that she is not a for-profit business, which is not. It's not a philanthropic organization either. They're not here to give out handouts. They're here to provide essential services to our community. I do agree with both Mr. Moss and Hambley that last minute communication is a terrible idea. Ms. Cosby said that she reached out in November. Everybody here knew that who was elected in November and December. They could have started communicating here. The state could have done better. Everybody in government could have done better. Going back to philanthropic businesses, Tipsy Training, I think it's a great program. It was mandated by the state, if I heard correctly, but it's a business expense. It should be thought of as a business expense. You guys have business things going on. They have that. I have recurring fees as an educator. They're not paid for. It's something that I have to take out of my own pockets, and that's teaching kids how to drive. And quite frankly, I'm thinking that having people that know how to drive, putting their phone down and being responsible, is more important than knowing when to stop drinking. Teaching kids to read is also important, but reimbursing teachers is only paid for if you're at an at-risk community. Well and septic costs, those are the cost of owning a home. They should be planned for and treated as such. Fee services like STI testing should be charged what they cost the county. This is not a philanthropy operation. That's forced philanthropy, and that's what organizations are for. As regarding the Title X money, we talked about that a little bit. I'm glad to see we still have some. Instead of Planned Parenthood, have they reached out to Positive Options and other such organizations to help them gain more money for what they do? Thank you.
Thank you. Any other comments? Okay, seeing none, as adjournment is at the call of the chair, I call this meeting adjourned.